Good afternoon. My name is Babette Small, and I'd like to ask you a question. How did it make you feel looking at the photograph of the bearded lady? Well, what I'm about to share with you might bring those abstract thoughts into a more accepting and compassionate light. Polycystic ovarian syndrome, better known to many as PCOS, is defined by the CDC, the Centers for Disease Control and Prevention, in the Infertility Reproductive Health article posted January 16th, 2019, as being a condition that causes women not to ovulate or to ovulate irregularly. Some women with PCOS have elevated levels of testosterone, yes, the male hormone, which can cause acne and excess hair growth, i.e., the bearded lady syndrome. PCOS is the most common cause of female infertility. Those facts were also given by the CDC. It's my goal to enlighten you on the topic so that you walk away knowing more about the cause of the bearded lady being bearded rather than it just being something freaky to look at. PCOS is one of the most common causes of female infertility, affecting 6% to 12%, that's nearly 5 million of U.S. women of reproductive age. But it's a lot more than that. The lifelong health condition continues far beyond the childbearing years. So the chances of you knowing someone or loving someone or attending class with someone with PCOS is great. The symptoms include oily skin, acne, missed or prolonged menstruation, excess hair growth, hair loss, weight problems, problems sleeping, infertility, high blood pressure, just to name a few. The diagnosis has to come from an MD, has to come from a doctor. To be diagnosed by a medical professional, it is generally accepted that one would need to have had a collection of symptoms, some blood work, a physical exam, a pelvic exam, and an ultrasound, just a battery of tests to narrow that down. Treatment includes, but is not limited to, anything from a change in your diet to weight loss and medication. Complications are great. Infertility, type 2 diabetes, heart, skin, hair, and brain issues, metabolic syndrome, cardiovascular disease, sleep problems, high blood pressure, depression, anxiety, liver complications, and uterine cancer. Embarrassing issues attributed to women that have PCOS that you, now that you know a little bit more about it, can assist with include, but certainly are not limited to, the abnormal body and facial hair growth, the bearded lady syndrome. We cannot control it. Weight gain, acne, and thinning hair on our head. Understanding and education hopefully will give way to compassion and a greater acceptance of those of us who live among you who suffer with PCOS.